Acidity, a cause for heartburn. Usually a burning sensation in the back of your throat, chest and stomach means a run to the medicine cabinet and popping an antacid tablet. But what is it that causes this annoying symptom, and is there more to acidity than meets the eye? Watch this video to find out all you need to know about acidity. Acidity is a term used to describe a set of symptoms caused by an imbalance between the acid-secreting mechanism of the stomach and the area of the colon. The stomach normally secretes acid that is essential in the digestive process and helps in breaking down the food during digestion. When there is excess production of acid by the gastric glands of the stomach, it results in the condition known as acidity. While once in a while a sensation of acidity may be just your stomach's response to spicy foods, regular episodes could signal more serious conditions that may impact the quality of your life. There are a number of terms used to describe the symptoms of acidity. They mainly are acidity, heartburn, indigestion, hyperacidity, dyspepsia acid reflux, peptic ulcer, and gastroesophageal reflux disease. Acidity or hyperacidity is due to the secretion of excess gastric acid. Heartburn is usually a painful burning sensation in the throat or chest. This is when the stomach acid travels up to the esophagus 2 times per week and may indicate GERD. Gastroesophageal reflux disease. Muscle at esophageal end closes incompletely such that the stomach content rises into the throat and esophageal. This is usually due to indigestion and hyperacidity. Peptic ulcer. Peptic ulcer is described as a sore in the stomach or small intestinal lining. It may sometimes be accompanied by bleeding. A peptic ulcer may cause pain and lead to hyperacidity and indigestion. Indigestion. You may have a feeling of fullness, bloating, nausea, heartburn, or gassy discomfort in the chest or abdomen. This can be caused by smoking, excess alcohol intake, medications, stress, hyperacidity, GERD, and/or an ulcer. This overproduction of acid may occur as a consequence of stress, diet, lifestyle, peptic ulcers, GERD, stomach tumors, or medications. The symptoms of acidity, usually after a meal, include restlessness, nausea, belching, sour taste in the mouth, stiff stomach, indigestion, and constipation. Normally, the stomach and duodenum are protected from the corrosive effects of the gastric acid by natural bicarbonate and prostaglandins, which are normally secreted in the mucous lining. These agents neutralize the acid and dilate blood vessels for regular blood flow, respectively. The breakdown of these naturally produced protective agents leads to a damaged stomach lining, which causes bleeding and ulcers. If you do suffer from acidity, you will be prescribed an acid-neutralizing or acid-controlling medication. Usually, antacids are the first line of defense. They help in neutralizing the excessive acids in the stomach. They are quick fixes for acidity but are not meant for long-term use. Antacids may contain magnesium, calcium, or aluminum-containing compounds. There are other medications that can be used, such as histamine-blocking agents or proton pump inhibitors that reduce the production of acid by the stomach. Rarely, a surgery better known as a vagotomy is used to reduce acid secretion. If your symptoms do not resolve within 4 weeks, your doctor will most likely run a few tests to determine the exact cause of the discomfort. Here's what you can expect. Upper gastrointestinal endoscopy to identify ulcers. Barium meal test for Zollinger-Ellison syndrome. Ulcer biopsy to detect tumors. Regardless of what your diagnosis may be, there are a few changes you might have to make in order to ease the symptoms. They are changes in diet. Avoid acidic foods including spicy and salty foods. Lifestyle, no smoking and alcohol, and stress reduction. Apart from all the medications and tests, there are a few things you can do at home to relieve yourself of the symptoms. Eat banana, watermelon, cucumber, yogurt, or jaggery. Add ginger to all food items. Drink water, coconut water, lemon juice, amla juice, or milk. Consume your last meal a few hours before sleeping. Have small, regular meals. Chew tulsi leaves, cloves, saunf, or chewing gum after and between meals. Avoid pickles, spicy chutneys, and vinegar. Reduce aerated soft drinks, smoking, and alcohol. A common homemade antacid remedy is to consume a half glass of water with half teaspoon of baking soda. Found our information useful? If you find the video helped you, please like it. Tell us what you think about our videos. Please leave a comment. To watch our other videos, click here. For more on your health, log on to health.india.com.